Hello, I'm Dr. Bains from Harpal Clinic. I'm going to talk a little bit about B12 deficiency. If you're curious enough to have watched this video, I suspect you probably are deficient or you suspect you are. Now, vitamin D deficiency probably was not very much of an issue before, but these days it's getting so bad that we're getting a lot of people coming in. For my medical clients, vitamin D assessment is something I do as a routine. And the results are frankly shocking. The number of people who are very, very low is very high, particularly endemic in people who have color of any sorts in their skin. So in these instances, you'll find that oral supplementations of B12 doesn't really do it. It's not quite good enough because once again, you face a situation where it may not get absorbed. One way out of it is to do sublingual drops of B12, where you put little drops under your tongue, it gets absorbed. It's quite nice versus tablets. The other thing you can do as well is the B12 injectables, and this is what we do at the clinic. This, of course, bypasses everything. It's a shot into your muscle or the subcutaneous tissue. It's usually less painful into the muscle. And you find that quite frequently for those who do have symptoms, the symptoms reverses fairly quickly. However, because it's a water-soluble vitamin, it's something that goes out of your body fairly quickly, within hours and days. The benefit stays because once a cell is healed, the healed cell actually is healthy for a very long time. But for people where the symptoms are quite severe, you'll probably find that you need to give the B12 injections fairly often initially, even perhaps say every week initially, until they get to a better place and are able to absorb it themselves. Or another way of doing it is during periods of high stress where you are forced to take your antacids, or if you're having a bout of a lot of abdominal problems, take it during those times, and the rest of the time stick to your oral or your sublingual. It makes a huge difference. It can really change a lot of things for a lot of people. And if you ever get to a point where they actually find it in your blood cells, and that which is a form of anemia, it's usually quite late. Group of people who commonly get these problems, and this is a number that we are seeing more and more of, are people with either classic gut dysbiosis or people who have diseases like Crohn's disease, celiac disease, ulcerative colitis, or even just irritable bowel syndrome. Now, it's well and good if you're actually given these labels, but for those who are in between, who are not end stage as in these people, that's becoming a larger and larger group that I'm seeing a lot of. So these are the people who would probably have a lot of bowel irritation, a lot of bloating, a lot of gas, and their bowel habits can range from either diarrhea to constipation, or it can change around. They frequently have not very good skin as well. They might have brain fog, have quite a lot of irritation. Pins and needles in the hands and the fingers is quite common. In these people, what happens is that the absorption of nutrients is quite poor. So along with B12, you'll find that there's also a deficiency of other nutrients. And the problem is not because they're not getting the right kinds of food, it's because they're just not absorbing the kinds of food that you would want them to.